Good morning, doctors. Welcome to Admin Podcast on CGHS Clinics. Medical certification of death is a very uncomfortable situation for doctors. To make this difficult topic simpler, we have with us senior CMO and in charge of one of the busiest wellness center in Pune, Dr.Vineeta Kaushik. Dr. Kaushik was to retire this year, but thanks to our government, her expertise will be available for another 5 years. So welcome back, Dr. Kaushik.
Hello friends, let me begin this session by first thanking Dr. Dharge and expressing my appreciation for the great initiative taken by him. Medical certification of death consists of two parts. One is the death certification and the other is the cause of death. Registration of Births and Deaths Acts 1969 provides the legal backing for this certification. It requires that the death be reported to the local authorities within a period of 72 hours. And any medical practitioner who refuses to or neglects to issue this certificate would be punishable with fine up to 50 rupees. Now we come to the actual certificate. Let us follow this. A patient is examined by a doctor and he or she is declared dead, which is relatively simple. Now, the next step is divided into two sections. One is the manner of death. On the left hand side, if it is a natural manner of death and the patient has been examined by the doctor in the last 14 days and the cause of death is known, the medical certification of death may be issued. The other section deals with unnatural deaths. If the doctor has not examined the patient in the last 14 days and the cause of death is not known, we need to inform the police and a medical legal autopsy will be done, and only then can the certificate of death and cause of death be issued. How do we define death? Death is the complete and irreversible stoppage of circulation, respiration, and brain function. The causes of death are many, and it is defined as the disease or injury responsible for starting the sequence of events which are brief or prolonged and which produce death. Now we come to the classification of the cause of death. It could be either the immediate cause or the antecedent cause and other contributory causes. We can also talk about the manner of death, the mechanism of death. Agonal period is defined as the time between a lethal occurrence and death. Now let us look at the causes of death. The first thing as we look on the certificate is it says the immediate cause. Immediate cause means the disease, injury or complication which caused a death, not the mode of dying such as heart failure or asthenia. And here we fill up part A of the certificate. Part B is the antecedent cause, which is any morbid condition which gives rise to the immediate cause. And here we write the disease which could have been the reason for the immediate cause. Part 2 stands for other significant conditions contributing to death but not related to the disease or the condition causing it. The other important thing to be entered in any death certificate is the chronological order of the illnesses and the condition causing the death. For example, if we talk about a patient who died of myocardial infarction and he had chronic ischemic heart disease and diabetes, let us enter it like this. Myocardial infarction for the past 1 hour, chronic ischemic heart disease for 5 years, and diabetes mellitus for 12 years. All local governments have a particular format of the medical certification of cause of death, which all doctors should be familiar with as to how it should be filled up. The doctor must put a stamp below his signature to certify the some general rules while certifying death. No abbreviations should be used. For example, not MI for myocardial infarction. We should not be writing modes of death anymore. For example, cardiorespiratory failure. No signs and symptoms to be mentioned like angina, tenderness, pain. And the antecedent cause, as it has been mentioned before, should be entered chronologically, etiologically, and pathologically prior to the immediate cause. There can be only one condition as the cause of death. If the exact interval between onset and death is not known, you can use words such as unknown, several years, or since birth. To list the causes of death, it would be relevant to refer to the International Classification of Diseases, which is ICD 10. Points to be noted while issuing a certificate of death. There should be no delay, there should be no charge, it should not be withheld for any invalid reason, and no one should be signing the MCCD in advance. And no medical practitioner should issue this certificate without viewing and examining the dead body personally. As a final tip to this podcast, my take home message would be a few important suggestions. The first one being, please examine the patient and take time before you issue a death certificate. Especially in infants, elderly, bedridden, and comatose, it is useful to take a little time and, in fact, also ask a colleague to check if available. Please do not allow any coercion, either emotional or physical, to force a medical person to issue a death certificate. With these few tips, I welcome suggestions from all our doctors on this topic. In conclusion, I would like to thank my colleagues who made this possible, and I hope this podcast was useful.